Infant Hydrocell Geodesic Sensor Net application. This video will explain how to apply the Infant Hydrocell Geodesic Sensor Net. We will apply the net to both a young infant and an older infant who has firm control over his neck muscles and can support his own head. The Infant Hydrocell Geodesic Sensor Net is very similar to the Adult Hydrocell Geodesic Sensor Net, with small modifications to increase safety and comfort. Infant sensors are made of a very soft, clear material that form-fits to the infant's scalp. Informed consent. There is, however, always a minimal risk of skin irritation or skin damage with the Hydrocell Geodesic Sensor Net. It is important to practice informed consent with the parents or patients during every net application. It can be reassuring to let the parents know there may be some red marks left on the skin after application, but that these marks almost always disappear within a few minutes. Measurement. Measure the circumference of the patient's head to determine the appropriate net size. Take this measurement several times to ensure accuracy. With a measuring tape, measure head circumference at the glabella or brow ridge and 2.5 centimeters or 1 inch above the inion, which is the bump on the back of the skull. The second measurement is to determine the vertex. Measure the distance between the nasion, the indented area where the bridge of the nose meets the skull, and the inion, below the occipital protuberance, where the skull first curves inward to meet the neck. Locate the halfway point. Next, measure the distance between the two preauricular points. The preauricular point is the indented area in front of each ear flap where the jaw meets the skull. Locate the halfway point. The crossing of the two halfway points marks the location of the vertex. For young infants, if you mark the vertex, do so very gently. Prepare net in solution. Before application, soak the net in standard potassium chloride electrolyte for 3 to 5 minutes, being sure to submerge all sponges. Remove excess electrolyte from the outside of the net to prevent dripping into the eyes. Position of infant. For young infants who do not have firm neck muscles, it is necessary to support the head during application, preferably by having an adult cradle the infant. Infants are less likely to be afraid or to cry when they are held firmly by an adult. Very young infants may feel most secure if they are swaddled before the application. This is also the positioning of choice for sleeping older infants. To apply the Infant Hydrocell Geodesic Sensor Net, position hands as for Adult Hydrocell Geodesic Sensor Net application. Count 2 sensors away from the nasion sensor and hook the thumbs under the double lines of elastomer. Before applying the net, check that the chin strap is positioned over the wrists and that no beads or straps are tangled in the net. Because young infants do not tense their neck muscles during application, Young Infant Hydrocell Geodesic Sensor Net application is a 2-step procedure. First, the net is applied from the front, and second, the net is pulled into position from behind. This ensures correct sensor positioning and good contact at the vertex. We do not recommend application of the Infant Hydrocell Geodesic Sensor Net from the side or from behind because of the risk of eye injury. Using the thumbs and little fingers to expand the perimeter, apply the net by gently pulling straight down onto the vertex, being watchful to keep sensors, straps, and fingers a safe distance from the infant's eyes. If the infant is too active for safe application, discontinue the application and wait until the infant calms down. Once sensor positions are aligned, immediately tighten the chin straps before letting go of the net. Next, position the infant in an upright position with head supported over the adult's shoulder. Gently pull down the back of the net to complete the application. It is usually necessary to readjust the chin straps. Upright Infant Hydrocell Geodesic Sensor Net application. For an older infant who is able to tense his neck muscles and support his own head, the hydrocell geodesic sensor net can be applied in an upright position. To apply the infant hydrocell geodesic sensor net, position hands as for adult hydrocell geodesic sensor net application, counting 2 sensors away from the nasin sensor and hooking the thumbs under the double lines of elastomer. Before applying the net, loosen the chin strap adjustment beads and place the chin strap behind the net. We do not recommend application of the infant hydrocell geodesic sensor net from the side or from behind because of the risk of eye injury. Using the thumbs and little fingers to expand the perimeter, apply the net by gently pulling straight down onto the vertex, being watchful to keep sensors, straps, and fingers a safe distance from the infant's eyes. Position the chin straps under the chin and tighten immediately before letting go of the net. The infant net is similar to the adult net, with different colored beads adjusting specific straps. The blue bead adjusts the chin strap. The white bead adjusts the ear electrodes. For infant nets with a face strap, the red beads adjust the face strap. Sensor positioning. After applying the infant net, you may need to adjust the sensors into the correct position. Infant application is a more gradual procedure than adult application. First, always make sure there are no straps or electrodes covering the eyes. Next, make sure that the ears are sitting correctly in the ear holes. Move the net by pulling down on large sections. Do not pull on individual sensors or the net will resist. After the adjustment is made, retighten the chin strap. Check that the reference sensor is correctly positioned on the vertex and that it is making firm contact with the scalp. Make sure that the net is positioned symmetrically on the head and that the midline of sensors is straight. Check the back of the net, making sure the sensors are perpendicular to the scalp and are not curled up. For the facial electrodes, check that they are evenly spaced across the face. A common error is seating the forehead sensors too high. After correctly positioning the net, seat all pedestals, righting any that are tipped. Edges of tipped pedestals could irritate sensitive skin. It is usually necessary to readjust the chin straps after sensor adjustments. During adjustments, it is helpful to have the parent reassure the infant. Comfort measures are generally necessary only during initial application. Young infants often seem to forget they are wearing the hydrocell geodesic sensor net soon after application. During wear time, a responsible adult must watch infants carefully. Infant nets with face straps. The hydrocell geodesic sensor net is also available with a face strap for infant nets. Infant EEG recording procedures. The Geodesic EEG System 300 is a straightforward yet sophisticated tool for recording dense array EEG. After applying the hydrocell geodesic sensor net, the technician plugs the connector into the Geodesic EEG System 300. The EEG recording is displayed on the screen, with the channels in a row on the left and the EEG scrolling in real time on the right. The technician can then check for any bad or noisy channels and get an immediate EEG review. Infant hydrocele geodesic sensor net removal. To remove the infant hydrocele geodesic sensor net, loosen the chin strap completely. Loop the chin strap toward the back, keeping it away from the eyes. Gently slip the net off. After removing the net, you may notice some superficial red marks left on the skin. These marks almost always disappear on their own.